The environment of care is where we work and where our patients receive care. Our environment is different from other industries, so we have our own particular set of concerns or risks. JCAHO stands for the Joint Commission of Accreditation of Healthcare Organizations. This body oversees DCH to ensure compliance with patient care, quality, and policy. In Joint Commission terms, the environment of care consists of our buildings, our equipment, and our people. So, we're going to look at the risk and prevention of those things which can endanger lives. There are 7 environment of care plans. They are broken down into 7 areas to help us focus on them individually. The first one is a general safety category that communicates and initiates all safety initiatives. The second one is security. We have dependent and ill patients who are not able to secure their own safety, be it from our internal errors or errors external to us. Third is emergency management, which is the management of any internal or external emergencies that have or might conceivably happen that would affect our healthcare operation. The fourth is fire safety. This is an entire management plan on how to prevent fires, as well as how to handle fire emergencies. Our patients are in beds that are operated by electricity. Many of our operations are dependent upon electricity. We have dependent and sometimes severely limited patients with mobility issues. We also have chemicals that are volatile if mishandled. The fifth area of environment of care is hazardous wastes and materials. We have everything from toner to cleaning solutions to radiation. It's very important to inform our staff of the risk, prevention, and emergency plan to deal with those hazardous chemicals. The sixth area is medical equipment. Because we touch equipment and we touch our patients with this equipment, we need to inspect it properly and take it out of use if needed. The last environment of care plan is utilities. Because we do depend so much on utilities for our operations, we must have backup plans prepared just in case. The agenda for this presentation is noted on the slide. First, let's talk about safety. Safety is everyone's job. It is the job of our board of directors. Our administrators are responsible. Our safety officer is responsible. We have a safety committee, and it is their job to plan, prepare, and communicate the safety plan. It is each department's job to ensure their patients and staff are safe and cared for. Finally, it is your responsibility and mine to keep everyone and everything in our environment functioning properly and safely. This slide lists our safety activities covered in our environment of care plans that help us prevent problems. As of January the 1st of this year, the facilities, buildings, and grounds of the DCH Health System are tobacco-free. The use of tobacco products is not allowed anywhere on any of the DCH campuses. Let's talk about security. Security is a major part of the environment of care. This slide lists some of the activities and steps that we take to ensure patients, visitors, volunteers, physicians, and staff are protected. Security is provided by G4S, Tuscaloosa police officers, law enforcement agencies, and you, DCH employees. When reporting security concerns, you may dial 7320 for security control. At Northport Medical Center, you may dial 22 or 0, and at Fayette Medical Center, you may dial 0. Code strong is when security is needed. Code blue is when there is a medical emergency and a crash cart is needed. Code red is for fire. Employees and non-employees must wear an identification badge. It needs to be worn where the name is visible, and it needs to be worn around in the chest area. Badges are color-coded to indicate the area in which you are working. Let's talk specifically about fire safety. Fire prevention includes our equipment, smoking, chemicals, and other sources of fuel. When we see a fire, we respond with RACE. RACE stands for Rescue, Alarm, Confine, and Extinguish. R for Rescue. Our responsibility is to reassure the patients and visitors, to rescue horizontally, then vertically. Any decision about oxygen will be made by the charge personnel. Alarm. You will need to pull the nearest alarm box, call out for help, dial 22, and call code red. Confine. Close the patient doors. Assure that fire and smoke doors are closed. Compartmentalization compartmentalizes the fire and the smoke for protection. And finally, extinguish. You'll take the fire extinguisher, pull the pin, aim the nozzle, squeeze the handle, sweep nozzle side to side. What should you know? You should know the locations of the fire extinguishers, know what the fire response is for your work area, know the locations of the pull boxes nearby. Please know that we do conduct drills quarterly and that fire extinguishers are checked by security on a monthly basis, annually by another company. The next section is emergency management. In managing emergencies, of course, we want to prevent as many as possible. When we do have an emergency management situation, of course, we want to be prepared by training, by having policies, and having community interactivity for internal as well as external disasters. Our response, hospital-wide and department-specific response plans are necessary. And of course, recovery is to return to our normal activity. Codes are how we communicate internally. These are the codes that we use for various emergencies. The next plan of care is hazardous materials and biomedical waste. There are 3 primary methods of waste disposal, also known as waste streams, in the hospital. Solid waste, biohazard waste, which is also known as regulated medical waste or red bag waste, and hazardous waste. It is important to know how to dispose of waste, not only because of cost, but because of legal reasons as well. Solid waste is the most common method of disposal of waste. It is very important that PHI, which is protected health information, be removed prior to discarding. These trash receptacles are usually lined with clear or white plastic liners. DCH Environmental Service employees are normally responsible for removal of this type of waste. Due to the more expensive disposal cost, it is important that we do not use biohazard waste for receptacles for solid waste such as paper and plastic. One of the ways we protect staff is our system of disposal of biohazard and medical wastes. As you see in this slide, needles go into a specific box that prevents needle sticks. Anything blood-soaked goes into a red bag, which signifies it is contaminated with human waste, for an example, blood. This slide covers hazardous wastes. Be aware that until all of the manufacturers of these chemical products have converted to the SDS format, you may also see both formats, MSDS and or SDS. Eventually, all chemicals will have safety data sheets, SDS. The information contained in both of these cover storage, disposal, health precautions, as well as what PPE to wear. PPE stands for Personal Protective Equipment. Hazardous chemicals are everywhere. You have the right to know what you are working with and around, how it might affect you, how to protect yourself, and what emergency steps you should take in case of exposure to these chemicals. Labeling is the most important protection for you against accidental exposure and subsequent treatment. The next section is related to medical equipment. Handling our medical equipment deserves its own environment of care plan. We have a department that focuses on the use of medical devices. We and our patients are at risk of electric shock, burns, and malfunctioning equipment. Our clinical engineering department maintains all of our medical equipment. Receptacles labeled emergency or critical are powered by a backup generator. These receptacles are red and are routinely used for critical medical equipment. Next is utilities management. For reporting utility problems, please contact the clinical engineering department at your facility. Let's talk about parking. Parking is part of security. We have provisions for employee and other hospital associates to ensure they are safe. Part of the provisions declare where persons can park and where they cannot park, managing the security of all involved. This slide shows where the day shift employees of the Regional Medical Center may park. Parking for evening and night shift is the same as it is for day shift employees. Evening and night shift employees are also permitted to park in designated employee levels in the south and west parking decks. It costs $2 to exit the deck. Employee parking at Northport Medical Center is designated outside the emergency department and the outside entrance of outpatient. At Fayette Medical Center, employee parking is designated behind or across the street from the hospital. Violators of DCH's parking policy are subject to disciplinary action. Our patients are why we are here. We should adhere to parking directions and allow visitors access to visit our patients. Other important information to know. Other important information we would like to share is radiation safety, back safety or safe patient handling, team communication and collaboration. Radiation has improved the quality of health care and its benefits are tremendous. However, large amounts of radiation may cause cancer and birth defects. To protect you, radiation exposure is strictly regulated by state and federal agencies. Most healthcare workers receive no more radiation exposure than what occurs naturally in the environment. It is important for you to recognize sources of radiation in your facility and rules for working around them. This symbol is one way to recognize radiation risk areas. There are two sources of radiation: X-ray machines and radionuclides. In order to protect your back at work, let's look at 3 common activities: standing, sitting, and lifting. Standing. To reduce the stress on your back and muscles, flatten the arch in your back by bending your knees and put one foot on a footstool. If you can't find a footstool, stand with one foot forward and your knees bent slightly. Alternate feet every few minutes. Sitting. Sitting puts more pressure on your spine than standing. To reduce stress on your back when sitting, move all the way back against the chair. Keep your feet on the floor or footrest and adjust the height of the chair so that your knees are slightly higher than your hips. Lifting places the greatest amount of stress on your lower back. Minimize back stress when lifting by stand close to the object, spread your feet wide to create a broad base of support, bend your knees and keep your back straight, hold the object close to you, use your legs to lower and raise yourself. DCH fosters an environment of teamwork. Teams are important at DCH to cultivate a diversity of ideas. Teams are used to solve problems, examine potential efficiencies, and launch new initiatives. Since patients cross different departments, it is vital that departments communicate effectively with each other and work together as a team to deliver excellent patient care. Collaboration is when 2 or more of us work together to achieve a common goal by sharing knowledge, resources, and learning from each other. Collaboration is also celebrating our differences, being open-minded, and finding new and better ways of working together. In an effective team, communication is the exchange of ideas and feelings in a way that respects everyone's contributions. Communication is a two-way process and it requires listening. It also requires honesty, sincerity, and being respectful of others' opinions and beliefs. Thank you for being part of the DCH health system. Be safe.